What happens to your body when you stop smoking after 30 days? Smoking is the #1 preventable cause of death in the US, killing over 480,000 people per year. The decision to put out your last cigarette is the first step in a transformative adventure that rejuvenates your body, mind, and spirit. But what really happens to your body once you extinguish that final smoke? Within just 30 days of saying goodbye to cigarettes, your body embarks on a remarkable path of healing and recovery. From the depths of your lungs to the beat of your heart, the changes are both profound and uplifting. In today's video, we will delve deeper into the 11 remarkable changes that happen in our body when we quit smoking. 1. Improved lung function. According to a study involving more than 8,000 patients, at least 25% of current cigarette smokers are at risk of developing the lung function feature of chronic obstructive pulmonary disease. Smoking damages the cilia, tiny hair-like structures that line the respiratory tract and play a critical role in keeping the lungs clean by sweeping out debris and mucus. Once you quit smoking, these cilia start to regenerate and function properly again, which reduces the risk of infections and improves the body's ability to handle respiratory mucus. This results in fewer respiratory symptoms such as coughing and shortness of breath and makes breathing easier. Moreover, once smoking is stopped, the lungs begin to clear out the accumulation of tar, chemicals, and other harmful substances that have been deposited over time. This cleaning process helps restore the lungs' ability to filter and expel harmful substances, further enhancing lung health and function. If you want to protect your lungs, broccoli may become a powerful food due to its high content of vitamin C and E and the presence of compounds such as sulforaphane. The recommended daily limit for broccoli to aid in lung health without over-consuming is about 1 to 2 cups of cooked broccoli. 2. Improved sense of taste and smell. When you smoke, harmful chemicals in cigarette smoke, like nicotine, carbon monoxide, and tar, interfere with your taste buds and the olfactory receptors in your nose. These substances cause inflammation and damage to the sensory cells, reducing their sensitivity and effectiveness. Essentially, smoking creates a dulling layer over these cells, preventing them from transmitting the full range of taste and smell sensation to your brain. Moreover, quitting smoking reactivates the regeneration process of sensory receptors. Both taste buds and olfactory sensors are continually renewing under normal conditions. To support this sensory recovery, incorporating zinc-rich foods may be beneficial. Zinc is known to be important for taste and smell functions. Foods like oysters, beef, and spinach are excellent sources of zinc. For most adults, the recommended daily limit is about 8 milligrams for women and 11 milligrams for men. However, oysters are particularly high in zinc. Consuming just 2 to 3 oysters may provide the full daily requirement. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Increased energy levels. The improvement in energy levels may be attributed to the enhanced oxygen capacity of your blood. Smoking floods your system with carbon monoxide, a harmful gas that binds to hemoglobin in red blood cells more effectively than oxygen does. This binding reduces the amount of oxygen your blood may carry, depriving your organs and tissues of the oxygen they need to function optimally. When you stop smoking, the levels of carbon monoxide in your blood quickly decrease, allowing more oxygen to be transported to your cells. This increase in oxygen availability boosts cellular function and overall energy. Magnesium plays a vital role in energy production by helping convert food into energy and supporting muscle function. Foods like almonds, spinach, and black beans are high in magnesium. The recommended daily limit for magnesium intake is about 320 milligrams for women and 420 milligrams for men. Consuming a handful of almonds, about 1 ounce or 23 almonds, may provide around 80 milligrams of magnesium, contributing significantly towards the daily requirement without exceeding it. 4. Better oral health. Quitting smoking leads to a rebalance in the oral microbiome. The heat and toxins from cigarette smoke disrupt the natural balance of bacteria in the mouth, favoring the growth of harmful bacteria linked to oral diseases. When you stop smoking, the environment in your mouth becomes less hostile, allowing the beneficial bacteria to recover and helping to reduce the risk of cavities, gum disease, and bad breath. The oral cavity is the first part of the body that is directly exposed to cigarette smoke and its noxious ingredients. Cigarette smoking gives rise to benign and sometimes malignant changes in the oral cavity. To further support oral health and mitigate risks associated with past smoking habits, incorporating foods high in vitamin C may be beneficial. Vitamin C is essential for the health of your gums, as it helps in the formation of collagen, a key protein that maintains gum integrity and aids in healing. Foods like oranges, strawberries, and bell peppers are rich sources of vitamin C. The recommended daily limit for vitamin C is about 65 to 90 milligrams for adults, with an upper limit of 2,000 milligrams to avoid potential side effects like stomach upset. Eating a medium-sized orange may provide nearly 70 milligrams of vitamin C, helping you meet your daily needs without exceeding the upper limit. 5. Enhanced immune function. You may know that smoking inhibits the body's adaptive and innate immunity. It may also suppress the activity of macrophages, an essential component of the immune system, and contribute to dysregulation, leading to tissue damage and excessive inflammation. Following the cessation of smoking, there's an improvement in the circulation of blood throughout the body, including to the immune system's organs and tissues. As you stop smoking, blood vessels relax and widen, improving circulation and enabling immune cells to move more freely and efficiently throughout the body to identify and combat pathogens and infections. Moreover, smoking alters the proportions and functioning of critical immune cells, such as lymphocytes, neutrophils, and macrophages. When you quit, these cells begin to return to their normal levels and functions, enhancing the body's ability to fight off infections and respond to immunizations more effectively. By shielding immune cells from free radical damage, vitamin E is an antioxidant that supports the immune system. Foods like almonds, sunflower seeds, and spinach are high in vitamin E. The recommended daily limit for vitamin E is about 15 milligrams for adults. Consuming a small handful of almonds, about 23 kernels, may provide almost the entire daily requirement of vitamin E without exceeding it. 6. Improved skin appearance. Smoking constricts blood vessels, including the tiny capillaries in the skin, thereby reducing blood circulation and limiting the supply of oxygen and essential nutrients to the skin. This lack of nourishment leads to a dull, aged, and unhealthy complexion. A 2021 review found that smokers had less circulating vitamin D. Vitamin D plays a role in maintaining the skin barrier and helps with tissue repair. When you stop smoking, blood flow improves almost immediately, allowing more oxygen and nutrients to reach the skin. This enhanced circulation revitalizes the skin, leading to a healthier, more radiant complexion. Furthermore, quitting smoking helps to restore normal levels of collagen and elastin, the proteins responsible for the skin's strength and elasticity. Smoking accelerates the breakdown of these proteins and slows their production, contributing to wrinkles and sagging skin. As the effects of smoking dissipate, the body may produce collagen and elastin more effectively, gradually improving the skin's texture and firmness. A small 2013 study found that changes in skin color that resulted from smoking began to reverse within 4 to 12 weeks of smoking cessation. Antioxidants help fight free radicals, reducing oxidative stress and aiding in skin repair and rejuvenation. A daily limit of about a half cup of blueberries, 1 ounce of dark chocolate, and a small handful of walnuts, approximately 14 halves, may provide significant antioxidant benefits without excessive calorie intake. 7. Decreased risk of infection. Quitting smoking results in improved circulation and increased oxygen levels in the blood, factors that are vital for robust immune function. Enhanced blood flow ensures that immune cells may be transported efficiently throughout the body to sites of infection. Similarly, higher oxygen levels support the metabolic needs of these cells, enabling them to function more effectively in combating pathogens. A study found that exposure to secondhand smoke is an independent but modifiable risk factor for atopic eczema and hand eczema in adolescents. Vitamin D is known to enhance the pathogen-fighting effects of monocytes and macrophages, white blood cells that are important components of the immune defense, and decrease inflammation, thereby helping to prevent infections. The recommended daily limit for vitamin D is 600 to 800 international units for adults, depending on age and other factors. Consuming a 3-ounce serving of salmon may provide nearly the entire daily recommendation, supporting immune health without exceeding the daily limit. 8. Improved heart functions. A study done in Asia found that smokers had a higher incidence of heart failure than former and never smokers. Nicotine, a major component of cigarette smoke, causes blood vessels to narrow and harden, a condition known as atherosclerosis, which may lead to poor circulation and increased heart attack and stroke risk. As you abstain from smoking, blood vessels begin to relax and widen, blood flow improves, and the risk of clot formation decreases. This enhanced circulation supports better heart function and reduces the risk of cardiovascular conditions. Omega-3 fatty acids are known for their anti-inflammatory properties and their role in maintaining heart health by reducing blood pressure, triglyceride levels, and arterial plaque development. The recommended daily limit for omega-3 fatty acids from fish is about 250 to 500 milligrams for adults. Consuming a 3-ounce portion of salmon may provide a significant amount of this recommendation. 9. Improved fertility. In women, quitting smoking may lead to a normalization of the menstrual cycle. Smoking is known to disrupt the delicate hormonal balance necessary for regular menstrual cycles, which may lead to menstrual irregularities and problems with ovulation. Improved hormonal balance following smoking cessation may enhance ovulation and increase a woman's chances of conceiving. Furthermore, quitting smoking decreases the risk of erectile dysfunction in men, a condition often caused by restricted blood flow due to smoking-induced damage to blood vessels. Improved circulation after quitting smoking may enhance erectile function, thereby improving the chances of natural conception. According to a study involving more than 3,600 women, the risk of infertility was found to be increased by about 42% among current smokers compared to never smokers. 10. Better mental health. The cessation of smoking reduces the levels of nicotine, a potent stimulant, in the body. Lack of nicotine lessens the neurochemical rollercoaster that fluctuating blood levels of nicotine produce, even though nicotine may momentarily improve mood and focus. This stabilization helps to lower anxiety and stress levels. The effect of quitting may be comparable to the effect of antidepressants. Quitting smoking also fosters a sense of achievement and empowerment. Breaking free from the addiction and regaining control over one's actions may significantly boost self-esteem and reduce feelings of helplessness, factors that are often linked with depression and anxiety. Foods rich in omega-3 fatty acids include fatty fish like salmon, flax seeds, and walnuts. The recommended daily intake of omega-3 fatty acids is about 250 to 500 milligrams for adults. Consuming a 3-ounce portion of salmon twice a week may meet this recommendation, supporting mental health without exceeding daily dietary limits. 11. Decreased cancer risk. Cigarette smoke contains over 7,000 chemicals, including at least 70 known carcinogens that may damage DNA, leading to mutations and the development of cancerous cells. By quitting smoking, the constant assault of these carcinogens on your body's tissues ceases, significantly reducing the likelihood of mutations and the subsequent development of cancer. Additionally, giving up smoking enables the repair of smoke-damaged DNA. Natural repair processes in the body might be able to repair some of the DNA damage that carcinogens have caused. Once smoking stops, these repair processes become more effective, reducing the accumulation of genetic damage and lowering the risk of cancer. A study with 320,000 participants suggests that a longer duration of smoking cessation may attenuate the risk of cancer in both men and women, and that even heavy smokers, more than 20-pack years, were found to benefit from quitting smoking. Now let's talk about 5 ways you may quit smoking easily. Quitting smoking is a journey unique to each individual, but there are several effective strategies that many people find helpful in their quest to become smoke-free. 1. Nicotine replacement therapy, NRT. This method involves substituting cigarettes with other nicotine sources to reduce withdrawal symptoms. Options include nicotine patches, gums, lozenges, nasal sprays, and inhalers. 2. Prescription medication. Certain medications may help you quit smoking by reducing cravings and withdrawal symptoms. 2 commonly prescribed medications are varenicline, Chantix, and bupropion, Zyban. 3. Behavioral therapy and support groups. Behavioral therapy involves working with a counselor or therapist to find ways to break the smoking habit and deal with cravings and triggers. Support groups offer the chance to share experiences and challenges with others who are going through the same process. 4. Develop a personal quit plan. Creating a personalized quit plan may increase your chances of success. This involves setting a quit date, identifying triggers that make you want to smoke, and developing strategies to cope with cravings and stressful situations. 5. Mindfulness and relaxation techniques. Stress and anxiety are common triggers for smoking. Techniques such as mindfulness, meditation, deep breathing exercises, and yoga may help manage stress levels and reduce the urge to smoke. Quitting smoking has profound and immediate benefits for every part of your body. Within just 1 month, these changes signify the beginning of a healthier, longer life. Each person's journey to quit smoking is different, and what works for one person may not work for another. It might take several attempts to quit smoking for good, but each attempt is a step towards a healthier, smoke-free life. Today, we learned about all the benefits that you may experience after quitting smoking. But did you know that there are other fruits and ingredients in your house that may become equally beneficial for your health? Want to find out more? Watch 11 health benefits of eating pineapples every day. Or watch 11 top health benefits of using baking soda daily. You may watch either or both of them. Have you tried to quit smoking earlier? Let us know in the comments section below.